Tyson Wesley is the executive director of Kashechewan First Nation, and he joins me now on the program. Tyson, how are you doing?
I'm pretty good. Thank you.
Thank you. We appreciate your time under the circumstances, of course. As we know, it's been just over a month since a local state of emergency was called. What's the latest update on the situation in Kashechewan?
Well, we have 1,700 people that have been evacuated over 5 sites in Ontario: Kingston, Niagara Falls, Cochrane, Kapuskasing, and Timmins. And we have 300, less than 300 people still in the community. So far, we've kind of made some progress with the clinic that had sewage backing into the basement. So that's been completely remediated, and all our clinic staff kind of moved all the equipment back into the nursing station. However, as the test results came in for crypto, the nursing staff had to leave.
In terms of the illness, for people who hear this parasite, people have become quite ill. They can be ill for a couple of weeks. How serious? Give us a sense for people who are quite healthy, but also people who have comorbidities as well.
Yeah, the symptoms range from like like dehydration, watery diarrhea, vomiting, nausea. People experienced bloating, sore stomachs. So these symptoms kind of vary between people. Some people are still experiencing symptoms after 2 weeks of contracting crypto, and it kind of varies from person to person.
At last reports, there were about just north of 60 people who reported feeling ill. I understand those numbers probably underreported as well. Do we have any updates on those figures?
I think we're at about 73 confirmed cases with crypto, with about 19 that are kind of not been tested, but they believe that they do have crypto. But the numbers that we're kind of having are kind of the lower end.
Hmm.
That's the floor, I'm being told, and the ceiling is probably much higher since testing wasn't immediate. And if one person gets crypto or gets diagnosed with crypto, tested, confirmed, they don't test for the other family members in the same household.
All right, you had mentioned the locations that members have been evacuated to. Just want to pull up a map just to show people how far. As you mentioned, some have moved to, have been evacuated to Kapuskasing and Timmins, but of course some as far as Kingston and Niagara Falls. Help us understand, how are those locations determined?
It's um, the locations are determined by their capacity to accommodate people, but at the same time, there is an assessment of their health facilities, if they're able to meet demands for an excessive amount of people entering the area. So they do an assessment on those. It's like if we send our people there, are they going to be waiting long to get long for hospital visits and whatnot? So that's one thing that they really determine. But yeah, it's a bunch of stuff that they kind of assess prior to evacuating our people there. So
Help us understand there, as you mentioned, there's about 300 people, several families who are still in Kashechewan. Help us understand, why are they still there? How are they able to access clean drinking water? Or how, in terms of concerns, if there are medical issues, where is the next possible place that they could go?
yeah, those people that are staying behind are crews that are still kind of like watching people's homes, watching pets. Like, we have a high number of dogs
Right.
in the community, so we're helping feed them. And but the other thing is, we've been evacuated for so many times over the years, and some people are just fed up with being evacuated and decided to stay, to be in their comfort at home. We do have set guidelines right now to kind of avoid the use of water, to do not consume it, to make sure to follow the rules that public health has kind of set up. I think, as I said, I think they're just evacuation fatigue that's happening in the community. As I said, the nurses have been pulled out, and right now there is no medical staff that can treat anybody in the community. However, since the winter road is open at the moment, they can access health facilities in Fort Albany, which is about an hour away. Where
Right.
we've been trying to work with ISC to kind of build a shorter winter road to Fort Albany, which would cut the time in half, but we haven't received any response yet.
I want to talk a little bit about the logistics for the people who have had to evacuate. What are some of the difficulties that you're hearing from being so far away from home? We're talking a wide range of demographics when we talk about elders, but we're also talking about students who are in the midst of finishing class as well.
Yeah, it's been very difficult, yeah, very difficult on our people to be evacuated in these host communities, and I know education is a big thing in our community, and we're trying to make accommodations to our students to make sure that they're still kind of doing their schoolwork. I think there's homework packages that are being set up by the Education Authority to kind of um, the, just the continuation of school. But however, this situation is really difficult for our students to kind of still get the level of education that they require. So it is difficult and exhausting. And what we've been hearing with people is they're tired, they're exhausted from having to deal with these constant states of emergencies for our community. So it is frustrating, and I know our people are just tired of it.
I can hear it in your voice, and I know, Tyson, you are no stranger to this. 2005 is not that long ago when an evacuation for E. coli happened that you had to experience as well. I know you're speaking here as an official, but I do have to ask, how are you doing psychologically? With having to deal with this, but also, having to explain to us something that has been in the headlines before, unfortunately.
Yeah, I was in the community back in 2005. I remember showering in brown water,
Hmm.
having to kind of my little cousins having skin issues and whatnot, and I do remember that. It's not it's still fresh in my mind, and I know even with the community, it's still fresh in their mind, and having to experience something again is quite difficult to really go through. I guess I did contract crypto myself.
Hmm.
I've been sick for the past like probably over 2 weeks now, and it's been frustrating to still have these symptoms, even though they're kind of going away slowly. So, um, but it just brings back memories of what happened in 2005, and now that it's happening again, it's kind of frustrating. And um, yeah, it's quite. It seems generational trauma at this point.
Hmm.
I remember one of our advisors speaking. Um, I think he remembers bathing his children in a bucket with bottled water, and now his child has to do that to his grandson. So it's kind of really emotional to kind of see that happen again, and kind of reoccurring again, which I think could have been avoidable.
Well,
Um,
well, let's talk about that. In terms of solutions, what would solve this in the long term?
I think like like right now we are in the midst of a water crisis, and once it just say everything is finished by March, we go home, and our community has to prepare again to evacuate because of the flooding that happens every year and the risks associated with that. Our people are in this loop that's always happening, and we have to do it again in a few months, and it is frustrating. The long-term solution would be to relocate our community and to expedite these processes.
Tyson, we did reach out to Indigenous Services Canada for a statement on the crisis, and spokesperson Eric had sent out one, and it reads in part: Indigenous Services Canada ISC continues to work closely with Kashechewan First Nation, provincial partners, Mishkekawa Council, Winnebago Area Health Authority, and Anishinaabe Aski Nation in response to the community's ongoing state of emergency. Minister Galmasty has been in contact with Chief Wesley directly and with National Chief Woodhouse Nepanak regarding the community's declaration of emergency and evacuation. ISC is working alongside leadership and health partners to make sure that community members have access to the necessary supports during this extremely difficult time. How do you look at the progress on potentially relocating your community?
The progress has been slow. I think we should have been definitely further ahead in moving the community. However, like we still have to go through additions to reserve land where we need to kind of get land from the government to kind of move the community there and just I don't know. I would say reducing these studies like I know we can do it, but it's just these processes have to be expedited and just to make sure that this is not a annual thing that we can do. Like, sorry, it's just frustrating. Like, we've been dealing with this for over 18 years, and the amount of money that the government has spent evacuating our community must amount to a large amount of money. So is the government's idea to continue on this spending? Is it cheaper for them to evacuate us every year and not move us?
What role, if any, does the rest of Canada play into this solution? Government aside, is there anything? Is there a message to the rest of the nation in terms of what they can do?
We need your help. I think people are tired of seeing us on the news every year about how we evacuate every year, and I think we're asking Canadians. And I've been getting emails from schools around Ontario to see how they can help. And I think one of the suggestions that they've been doing is writing to the premier, writing to the Aboriginal Affairs Minister in Ontario, Greg Rickford, to also the premier and also to ISC and the government. I think if I think helping us get our message across and helping us put pressure on the government to expedite these processes would be the best thing that um, Canadians can do for our community is to help us move our community to a safer location and investment in infrastructure can be properly made and water crisis like this doesn't happen to us and hopefully any other community. So it needs to stop. I think this is not us. We're not in a third world country. This is Canada. We're richest among the world, and I think it needs to stop, and it has to stop.
Tyson, we're going to have to leave it there. I appreciate you taking the time under the circumstances. We sense your frustration. We wish you and your community well and hope things do get fixed. Thank you so much.
Thank you.